who in your wisdom and goodness have appointed the offices of leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your able to treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory. And that I'm going to ring the quorum bell for the first 5 minutes. I'm seeing the deputy whip there. You can whip the members who are out. As that's being done, all the members who are already in, you will not leave the house until the quorum bell is comes to stop. today.
Supplementary order paper number 402B of today, Thursday, 2nd April 2026 at 2:30 p.m. Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
Honorable Joaquim Okech. Yes, what is it, Honorable Harindu?
Thank you, Mr. Speaker. I wanted to lay a paper on behalf of the Budget Committee Chair.
Proceed.
Thank you. Mr. Speaker, pursuant to the provision of orders number 192.6 of the standing orders, I wish to table today, Thursday, 2nd April 2026, reports of County Budget and Appropriation Committee on consideration of the proposed Kisumu County Supplementary Estimates number 1 for the financial year 2025-2026. Thank you.
Honorable members, the Select Committee on County Budget and Appropriation of Table report on the consideration of the Kisumu County Supplementary Estimates number 1 for the year 2025-2026. And the Director of the House Business Committee considers scheduling this report for debate. And the clerk to ensure that the members have the report early enough. Next order.
Order number 6, notices of motion.
Sir, Honorable Lindu.
Thank you, Mr. Speaker. Again, pursuant to the provision of orders number 45.1 of the standing orders, this Assembly adopts the report of County Budget and Appropriation Committee on consideration of the proposed supplementary estimates number 1 for financial year 2025-2026.
What is it, Honorable Boyton? Next order.
Order number 7, statements.
Next order.
Commencement of business. Order number 8, motion. Adoption of the report of Medical Services, Public Health and Sanitation Committee on the status of Social Health Authority and the quest for Senate intervention.
Honorable Emilio Ginga.
Thank you, Mr. Speaker. Allow me to move this motion on behalf of my chair, who is away on official duty. Honorable Speaker, the Committee on Medical Services, Public Health and Sanitation has a report on the status of Social Health Authority claims at Kisumu County Referral Hospital at the quest for Senate intervention. Honorable Speaker, sir, the genesis of this report is rooted in an impromptu oversight visit conducted by the Committee on Medical Services, Public Health and Sanitation to the Kisumu County Referral Hospital, that is KCRH, on 23rd of February 2026, while exercising its mandate under Article 185.3 of the Constitution of Kenya and Orders number 193 and the second schedule of the standing order, The committee sought to evaluate service delivery and identify emerging hurdles the facility is facing in its strive to offer quality health care. During the engagement exercise with the hospital management, the committee uncovered, among other challenges, a staggering financial crisis befalling the hospital. While the facility continues to treat via the formal documentation, the committee shockingly established that the hospital is currently owed a total of 148,423,995 shillings in rejection and return claims. Honorable Speaker, the transition from the National Hospital Insurance Fund to the Social Health Authority, that is SHA, under the Social Health Insurance Act 2023, was intended to usher in a rights-based era of universal health coverage, UHC, through the Taifa Care Program. In this light, therefore, social health of data-driven future. This, the authority intended to achieve through a self-sustaining system where the right to health facilities to timely reimbursement is codified over and above the power to penalize a facility for malpractice. The transition, while having registered significant strides with requisite digital adaptation from health providers, the report details the legal and operational failures of the SHA framework and provides a statutory jurisdiction for the County Assembly to petition the Senate to protect devolved health services. Honorable Speaker, number one, the national context, that is a systemic threat, that the crisis at KCRH is a microcosm of national collapse. Between October 2024 and January 2026, over 123,000 claims were rejected nationwide. That is the KCRH case. The committee established that the hospital is currently paralyzed by a massive backlog of unpaid claims arising from technical and administrative rigidity rather than clinical malpractice. Rejected claims, that is 94,125,576. Those claims were summarily closed in the SHA system. This summary execution of claims denies the hospital 8,298,419, despite the hospital complying with the SHA requirements and resubmitting these claims as far back as of the Social Health Insurance Regulations 2024. We have a table there indicating the rejected claims and the returned claims and the amount and the total as stated previously. The committee further observed that there's a systemic failures and breach of natural justice. Emergency admissions where digital entry was delayed. The valid claims for maternity and surgical services often undertaken with prior SHA approval are rejected because the SHA platform lacks specific procedure codes to be reasonable and procedurally fair. And the committee also established that the comparable challenges were reported in counties such as Uasin Gishu County, Bungoma County, and Mandera County in the expeditious verification, processing, and settlement of pending claims. This intervention underscores the critical role of proactive executive leadership in unlocking administrative bottlenecks within intergovernment health financial frameworks. Number one, the committee observed that the claims in question relate to services already rendered to patients under the National Health Insurance Framework, and that closure of claims without providing facilities the opportunity to correct administrative errors violates principles of fair administrative action. The committee further observes that that delayed processing of returned claims, despite resubmission, indicates systemic inefficiencies within the SHA digital platform at the national level, creating operational tensions. The committee further observed that without urgent intervention, county referral hospitals may face severe financial distress, jeopardizing healthcare delivery. It is a direct threat to human life And the committee observed that the lack of liquidity has led to supply shortages, that is the inability to replenish medical consumables and procure essential medicines. Number two, utility arrears, critical risks to the supply of electricity, water, oxygen, which are the lifeblood of any referral facility. Good distract. Our staff distress, that is delayed revenue streams affect staff allowances and statutory deductions, leading to a sharp decline in morale among health workers. And the fourth one is service degradation. That is the residents of Kisumu face delayed surgeries and reduced diagnostic capacity. Mr. Speaker, sir, the second major challenge is operational impact on service delivery that was observed by the committee. And the utility risks, that is failure to settle bills for electricity, water, and life-saving oxygen systems, and in practical, 6,000 kilograms of oxygen monthly at a rate of 220 shillings per kilo. This results in a monthly statutory deductions and staff allowances, leading to declining motivation among frontline workers. Protects the financial health and the physical health system of the county by invoking the oversight powers of the Senate. The dispute resolution path intended for pursuing fraud-free healthcare system must not be exercised at the expense of an administrative justice and the eventual collapse of a functioning referral health system. Because the ultimate measure of the success of the social health authority must be the ability to balance the seamless health services, which is a constitutional right for all Kenyans, and the stringent oversight of health financing systems as required by law. Mr. Speaker, sir, this leads to limitations of internal dispute resolution, whereby while Section 44(2)(b) of the Social Health Insurance Act number 16 of 2023, which provides for an internal adjudication process for returned claims escalating to a dispute resolution tribunal, the committee finds the mechanism inadequate for the current crisis. The technical failures at the SHA have become systematic, directly impacting the financial stability and the operational capacity of a devolved unit. When a national agency's administrative failures incapacitate a country's abilities to function, the matter transcends simply simple administrative review and becomes a matter of constitutional significance. There are legal parameters and statutory bases for this intervention. That is the constitutional mandate of the Senate. The intervention of the Senate is anchored in the following legal foundations. That is Article 96(1) and 3 of the Constitution, that mandates the Senate to represent the counties and to serve to protect the interests of the counties and their governments. And Article 96(3) specifically empowers the Senate to exercise oversight over national revenue allocation to the county government. And in the fourth schedule, explicitly characterizes health as a devolved function, placing the burden of service delivery on the county government, while the financing mechanism remains a national oversight. There's a standing orders and intergovernmental relations. The path for this petition is further supported by the Senate standing orders. That is standing order number 2225, which governs the Committee on Devolution and Intergovernmental Relations, mandating it to protect county interests and oversee the implementation of the County Governments Act. And the standing orders number 236 and 238 provides the formal procedure for the Senate to receive and process petitions on behalf of counties. And thirdly, Intergovernmental Relations Act, which is the current failure of SHA, a national agency to reimburse a county facility, and constitutes a formal intergovernmental dispute, as it prevents the county government of Kisumu from discharging its constitutional mandate. Honorable Speaker Shah, on the issue for determination, there's persistent administrative and technical failures in the claims management system under the Social Health Insurance Framework, and they have disrupted the reimbursement of funds to county health facilities, undermined the operational capacity of devolved health units, and created a situation amounting to an intergovernmental dispute. In particular, these failures have adversely affected service delivery at the Kisumu County Referral Hospital. Therefore, Honorable Speaker, the matter presented herein transcends routine administrative dispute resolution and warrants Senate intervention due to its constitutional, financial, and intergovernmental implication. A structured legislative response is necessary to safeguard devolved health functions and restore effective service delivery within Kisumu County. On the recommendations, Mr. Speaker, sir, it is important to note that the decision to withhold the funds is not just a natural administrative act in the sense of it. It is a disruption of the hospital's operation capacity. The failure to correct the resubmitted claims dating back to the month of July 2025 and closing of the rejected claims without provided avenue for appeal, SHA has effectively staffed the Kisumu County Referral Hospital and many other health facilities of the needed resources to settle the utility bills, they pay wages, and most importantly, procure essentials like medicine and oxygen. This is creating a bad precedent where technical challenges in the SHA national systems put at risk the lives of the county residents. In this regard, the committee recommends as follows, Mr. Speaker, sir. Number one, that the County Assembly, through the Office of the Speaker, formally petition the Senate to investigate the systemic rejection of claims to health facilities within the county with reference to KCRH. Secondly, that the Senate should compel SHA to conduct an independent audit of all rejected and returned claims, and further demand that the authority to immediately settle all verified claims older than 90 days as per Regulation 32 of the Social Health Insurance Regulations 2022. Thirdly, that the Ministry compelled of Health must improve digital interoperability and establish a transparent claims review and dispute resolution mechanism. The fourth one, that SHA to provide quarterly reports to county governments detailing claim approval and payment status. The fifth one is that the governor of Kisumu County urgently undertakes direct engagement with the management of SHA and relevant national authorities to address the delays in claims reimbursement with a view to securing expedited verification and settlement of all outstanding claims owed to health facilities within the county. Further, the government should establish a structured intergovernmental follow-up mechanism to ensure a sustained resolution of such claims and prevent recurrence of similar delays. In conclusion, Mr. Speaker, sir, the Kisumu County Referral Hospital has honored its social contract by delivering healthcare to the people. It is now time for the national government to honor its legal and financial obligations. We must not allow technical system failures to orchestrate the permanent loss of public funds or the collapse of our health system. This report, therefore, is submitted pursuant to the provision of Orders number 193.5G, and with the hope that its recommendations will lead to enhanced intervention and a healthier Kisumu County. It is now my pleasure on behalf of the committee to move this motion that this House adopts this report of medical services, public health and sanitation on the status of Social Health Authority, SHA, at Kisumu County Referral Hospital and the quest to Senate intervention. And I therefore call upon Honorable Patrick Lumumba Wale to second.
Honorable members, now that the motion adoption of the report of the Medical Services Public Health and Sanitation Committees on the status of Social Health Authority And the quest for Senate intervention has been moved, seconded. I want to propose a question, and I propose that the motion is open for debate. Honorable Beni Peta yuko.
Mr. Speaker, these are the times when we could be well-bodied people who will just take rungus and go to Nairobi to beat the office. When we see our people suffering this way and the money is not forthcoming, if the money should be brought to our facilities to buy the commodities, to pay the wages, to do the other things that the healthy facilities need, and an office declines to release about 150 million for simple clerical errors, which the facilities should be given instruction to correct, and the payment is formalized, it becomes very, very painful, Mr. Speaker. But Mr. Speaker, SAR being a new system that was introduced, and one would question, was proper induction training given to the health facilities on how to make the claims? Or they were left in the darkness to make claims the way they used to do, doing the National Hospital Insurance Fund, and that is what could have brought all these problems. Or the SAR office has suspicion that any claim made to the office is just a fraud. It is very painful, Mr. Speaker, when our facilities are suffering the way they have been, and when our people go to the healthy facilities, there are no drugs. And you know, with them, they blame us. They don't know that it is the SAR that is bringing problems. They will blame the county government, yet the county government had put in place the good mechanism to offer good health services to our people, and that after our people have been charged in the health facilities, SAR should pay the money. But SAR has now brought for us problem on the ground. 94 million was rejected, Mr. Speaker. 48 million was returned claims. And by the end of the report, we are not getting whether this 48 million that was returned had been formalized and paid to the health facility. We need to get that picture. And Mr. Speaker, when we go through this report and the stories we get on the ground, it is not only Kisumu County Referral Hospital that is affected. Most of our health facilities are affected because SAR is not paying them their claims in good time. And if it is that the Assembly can petition the Senate so that our health facilities get their claims, I plead that with the health committee that you are also referring here to other health facilities. Let us get the record of other health facilities so that when the report is going to Nairobi, we don't leave behind our other health facilities because they are equally affected, and particularly the ones in the rural areas. Mr. Speaker, you see a mother carrying a small child to the hospital, and when she reaches there, the commodities are not available. Let us get the proper records of all our health facilities that are affected, and we write that report at once to the Senate and to the governor, so that the office of SAR can see the seriousness of what the Kenyan people are facing on the ground. And Mr. Speaker, this is a good move when our facilities are being frustrated by the national government institution. We need to open our mouth and tell them that is wrong. So this is a good report. I hope, besides the fact that all the facilities are not included here, the committee is going to do due diligence to include all the facilities, so that a good report is taken to the Senate and the governor. And this is where we can also open our mouth loudly, so that we are heard in Kenya that SAR is unfair, is offering a disservice to the Kenyan people in this area. Honorable Speaker, I so submit.
Honorable
Mr. Speaker,
I know you want to say you are senior, but you know,
I don't want to use the word senior,
Honorable
Mr.
Boyton
Speaker.
is a chairperson, so so can you agree amongst yourself who is coming first? I see he respects your seniority.
Okay, thank you, Mr. Speaker. Actually, I listened to the deputy chair for this very committee reading out the report, and I was keen with the words, and also read whatever that was sent to us through the soft copy. Mr. Speaker, without trying to make things look maybe in a way to convince others, I want to tell you, Mr. Speaker, that I have a friend who comes from Nyalenda A, who actually is in a private sector, and he does work by selling medical equipment to many institutions. And from there, I'm privileged to hear much about SHA and how they pay hospitals. One thing that I've liked about SHA, most of the things they have been doing, they normally gazette the payment schedule and where they disburse the payment. Mr. Speaker, before I come to the issue before the Assembly today, you'll realize that to some extent, SHA has given life to many dispensaries. And if you look at the money dispensaries are getting through disbursement, you'll wonder that this can be a good thing if properly used, Mr. Speaker. I'm aware about dispensary in my ward. I'm keen with the dispensary at Nyalenda B. I always follow this money sent to dispensary from the SHA, and you realize that this disbursement is so good until some of us tend to market our dispensary so that our mothers or those who want to give birth can go to maternity wing in most dispensary within our locality. But if you look at the point in this report, Mr. Speaker, here is a very special case of Kisumu County Referral Hospital. And that's why the report is about Kisumu County Referral Hospital, but not many dispensary or rather institution within the county. And for that reason, there's a special case where there was that rejection of claims. And rejection of claims came because of a lot of issues surrounding SHA of fraud. And the institution has tried so much to explain why such things happened and also to seek intervention. And one of the institutions that can intervene on their behalf is Kisumu County Assembly. And the proposal by the committee that this should be a petition to the Senate, and maybe now from the Senate they can meet the ministry and resolve this scenario with Kisumu County Referral Hospital. If you are keen, if you look at the reason why I'm bringing that case, if you look at the disbursement that SHA normally gazette of hospitals and you want to do business with the hospitals, you'll realize that some hospitals get good money. But if you have a problem with Kisumu County Referral Hospital, then it should be collective effort of the county, and the assembly marks a good channel to try to petition the ministry to listen to Kisumu County Referral Hospital and solve that. So with the committee and the chair, the acting chair was reading the report, I want to support this report of yours and the recommendation that this should be petitioned. I want to support this so that the petition can go to the Senate and the ministry can give the officials or those officers of Kisumu County Referral Hospital to explain why that had to happen. Because it's a public hospital, I know they had no plan or any malice in the information they provided for payment. And for that reason, we cannot say that they wanted to fraud or to do anything harm to the SHA. But the point where rejection can be done, yes, can be clerical errors, which when it is pointed out, I believe that the ministry can listen to Kisumu County Referral Hospital. 148 million is a lot of money. 148 million is a lot of money, and it can change the face of the facility. So for that reason, Mr. Speaker, I support the committee recommendation and approach to this issue so that the referral of the institution can be given time through the Senate and the ministry so that they can reconcile and agree so that much of this money can be sent to assist the facility. Remember, this is already a bill that has taken place, and with that, we feel like for the county to run smoothly, they have to pay many providers. So they need that money like yesterday. And for that reason, I support the report. And I believe with the SHA, we can always expect more. We need to encourage our people to register and use SHA. And number two, we need to encourage our people to use the local dispensary or health centers so that those health centers can also get their claim and get money. Thank you, Mr. Speaker. I support the report.
Thank you, Mr. Speaker. Mr. Speaker, I want to start from a positive point. Mr. Speaker, the report that has been read by the Deputy Chair is very clear. The public do not have problem with SHA. The payments from patients are also effectively done. In fact, Mr. Speaker, truth be told, it's a little bit different from National Hospital Insurance Fund, where monies were being paid on a monthly basis. We've realized that SHA compels patients to pay 4 months, 6 months, or up to a full year. This actually should necessitate the payment that they should give to these hospitals promptly. The question is, and the matter is, when the hospitals run out of medicines and the reagents that they use, the patients that come after that will definitely suffer, Honorable Speaker, because there are going to be no medicine. The facilities will wait until the payment comes from SHA. This is where this assembly seeks the intervention of the Senate. And as we talk about intervention of the Senate, Honorable Speaker, Kisumu County also have as a senator. What is the senator doing? And the senator wants to be the governor in 2027, while his people are suffering in terms of medical services. It's high time the senator picks up this report and run away with it. Otherwise, Honorable Speaker, everywhere he will be attending rallies, that will be the first question that we will tell the people to ask. Honorable Speaker, as we all know, that SHA is working. And that is why we have several occasions advised our people to register. But the bottom line, people register, but they don't get services from public hospitals. If you look at the way private hospitals operate, at no given time you will find that there are no drugs in private hospitals. At no given time you will not find that there are no services in private hospitals. Why public hospitals? Yet private hospitals are paid by SHA at the right time. This is where our concern is, Honorable Speaker. And I want to thank the committee, because a healthy nation is a working nation. There is no way our people will be healthy, our people will be productive in all spheres of life if the county is unwell. Honorable Speaker, with those very many remarks, I support and I hope this report will reach the necessary urgency for speedy and quick intervention. Thank you, Honorable Speaker.
Yes, Honorable Alice Waja.
Thank you, Mr. Speaker. Telling from the mood of the House, I wish to call the mover to reply. Thank you.
Honorable Emily Ogenga.
Thank you, Honorable Speaker. Honorable Speaker, as I reply, it's unfortunate that today we are talking about SHA. This is one thing that really affects our people. I can tell this House today that when we were walking to KCRH, we thought we were going to find some faults in that facility. Unfortunately, we hit a dead end. The moment we had that about unclaimed claims, about unpaid claims, we hit a dead end and we became helpless, Honorable Speaker. So today I was actually expecting a lot more contribution on this matter, because this is something that is really affecting our people, especially service delivery at our health facilities. Mr. Speaker, sir, as I reply, I'd like to re-emphasize on this matter, especially on the points brought about by my fellow honorable members, especially Honorable Kelvin Oraro. When I heard him talk, I thought that maybe at times when you're in this house, we are not keen. Honorable Speaker, I remember previously we've brought here reports on health facilities. The committee has gone around this county. We have sampled health facilities across the county, in all the 7 sub-counties, and we brought these reports. And it's unfortunate to hear a honorable member claim that SHA actually reimburses facilities. And I remember so well that in most of our reports, usually we have 5 key issues that need to be handled. The first one usually is the claims on SHA. Most of our health facilities are deprived of funds because the national government rarely, either they delay in reimbursing funds or they just don't reimburse funds completely. So you find most of our facilities cannot operate because they are deprived of funds. The second key issue that actually affects our facilities is staffing. You go to a facility and you find one staff that has to handle a very big number of patients. That has always been an issue, and it cuts across in most of the facilities that we've visited previously. Another issue is on medical supplies. You'll find a facility operating, but when it comes to distributing medicine, you find they'll go to the pharmacy and they'll be told that there's no stock. And why is this happening? Because the facility doesn't have funds to restock because of late reimbursement or rejected claims. Another issue that actually affects our facilities is on promotions. Most of the staff in these facilities have stayed in these positions for quite some time, and they get demoralized. So you can imagine the health workers who work in these facilities, what they go through, because number one, you don't have funds to operate. Number two, you've been in that position for quite some time, you're not promoted. And number three, you claim, people come to the facility because they've been told by the president that when you go to a health facility, don't pay even a single cent. Go there and be treated. So you find them really frustrated because people go there with the entitlement that the president has given them, and they expect you to offer the services. It is really frustrating, and it's killing our health facilities. And actually, it is killing our people because they're not able to access good services at the facilities. Therefore, Mr. Speaker, just to echo on what Honorable Boyton mentioned, the amount deducted on SHA is not any child's play. It is it's a big amount of money. It's a huge amount of money compared to what we used to pay during the NHIF days. As we pay this amount of money every month, we expect better services. Our people expect better services when they visit these facilities. And it is unfortunate that the more you pay, the poorer the services become, which is very discouraging. It becomes very difficult for us, even as leaders, to go out there and encourage people to register for SHA. You cannot talk about it confidently because the result is poor. It is embarrassing when you visit these facilities. So, Honorable Speaker, I believe when this document goes to the Senate, my prayer is that our Senate, and especially led by our Senator, that is Honorable Tom Ojenda, who unfortunately has never visited this house, just like Honorable Boyton mentioned. I hope he will be able to take over this issue and help our facilities, if not just KCRH, but even the other facilities, be able to receive money so that they can be able to offer the right services as they are mandated. Otherwise, Mr. Speaker, sir, just like we say that a healthy nation is a wealthy nation. Thank you, Honorable Speaker, and I reply.
Honorable members, and now that the motion adoption of the report of the Medical Services, Public Health and Sanitation Committee on the status of Social Health Authority and the request for Senate intervention have been moved, seconded, debated, and reply made, I want to put a question, and I put that as many of the opinion that the motion adoption of the Medical Services, Public Health and Sanitation Committee on the status of Social Health Authority and the request for Senate intervention be adopted, say aye. As many of the contrary opinions say nay. The ayes have it. The motion adoption of the report of the Medical Services Public Health and Sanitation Committee on the status of Social Health Authority, SHA, and the request for Senate intervention have been adopted today, Thursday, the 2nd of April 2026 at 15:35 hours. And I want to direct that the recommendation of the said report be communicated to the relevant agencies for action, and that implemented committee follow up on the same. Next order. Honorable Boyton, you, I think by the end of the session, you will have sat on all the chairs. Because at one point, my eyes caught you somewhere here. Another time, I saw you contributing from that corner. Now I'm seeing you here. I'm afraid that you will have sat on all the chairs. You need to be identified by where you sit. Clerk, next order.
Order number 9, motion. Adjournment of the County Assembly sittings for short recess until Tuesday, 21st April 2026 at 2:30 p.m.
Thank you, Mr. Speaker. Mr. Speaker, acknowledging the provisions of Standing Order number 26.3 relating to the calendar of the County Assembly, and further the resolution of the House made on Thursday, 19th February 2026, in which this Assembly resolved that short recess would commence on Friday, 3rd April 2026, and end on Monday, 20th April 2026. Further acknowledging the demanding nature of legislative duties and the need for honorable members to adequately engage with constituents, address community concerns, and undertake committee and oversight activities during the recess period. Now, therefore, the Assembly, while reaffirming its commitment to orderly legislative proceedings and acknowledging the importance of the short recess in enhancing effective representation and performance of legislative duties, resolves that the County Assembly do now adjourn its sittings until Tuesday, 21st April 2026 at 2:30 p.m. I therefore, Mr. Speaker, propose Honorable Eunice Alando to second. Thank you.
Thank you, Mr. Speaker. I rise to second the motion by the deputy majority leader on the adjournment. Mr. Speaker, I also want to confirm that we need support, that we need to have an adjournment so that we go and interact with the electorates after having had such a thorough exercise of performing our role of legislation, and now we need to go and share with the electorates where maybe areas that they are not very much comfortable or understanding well, and also to be part of them and understand their problems, so that when we resume back, we'll know where to start and the services to perform, so that we give good services to our people. Thank you.
Honorable members, now that the motion adjournment of County Assembly sittings for short recess until 21st April 2026 at 2:30 p.m. have been moved, seconded, I want to propose a question, and I propose that the motion is open for debate. Yes, Honorable Jennifer.
Asante sana Bwana Spika. Bwana Spika, ningependa kuchangia kidogo kuhusu adjournment. Tunaenda kwa likizo mafupi. Ningependa kuomba waheshimiwa wenzangu tukienda kwa likizo ni wakati mzuri, wakati zenye tunaweza kutoa watu wetu wajitokeze kwa wingi, wachukue kura, wachukue kipande. Tukipata nafasi kama hii inaweza kuwa mzuri, sababu ni wakati wa mvua. Tunasikia vile mvua mali pengine zinaharibu area zetu. Tukiwa hapo kama washimiwa, tunaweza kuwa vile tunaweza kuwasadia electricity zetu. Kwa hivyo nimeunga mkono kwenda likizo mfupi, sina mengi, lakini naomba washimiwa wajaribu wajitokeze kwa wingi, watoe watu. Kama leo nimesinda kutoka asubuhi, tukitoa watu watoke wachukue kura, watoke wachukue kitambulisho. Ukitaka kutoa mwenye utaki, unatoa ukiwa na kadi. Ukitaka kurudiza mwenye unapenda, unamrudiza ukiwa na kadi. Kwa hivyo, tukienda nyumbani, tusikae tu kwa nyumba ati tuko likizo. Asante sana Bwana Spika.
Honorable Mildred.
Thank you, Mr. Speaker. Mr. Speaker, I don't know why Boyton keeps looking at me and laughing, but I'm sure it's because of how he keeps moving from one chair to the other. I want to support the adjournment motion on the floor of the House, Mr. Speaker. It's not that we don't go home. Sometimes people think that when you adjourn, you have an opportunity to go home. I know we go home every evening, we come in the morning. Even that term that they say, going home, Didala, it doesn't mean anything to us because we go home every evening. So the adjournment is necessary, Mr. Speaker. I want to support Honorable Jennifer Obonyo, who has made it important that it's important for all of us to mobilize the people on the ground, that they're able to take their identity cards. And once people take identity cards, they're able to register as voters. The only way they can elect their leaders is through voting. And it's important during this short period, we can take our time to educate the people on the ground. We are going at a time that it's a rainy season. Most of the roads are impassable. Many roads have been spoiled by the rainy season, Mr. Speaker. And we are going to have a lot of explanations to give to our constituents regarding the state of roads. It's also coming at a time that the procurement process for major projects have not been carried out, Mr. Speaker. And how I wish the procurement process can be carried out fast, because we are fast approaching the end of the financial year, Mr. Speaker. So I would urge everyone, please keep safe. It's rainy season. Do not drive on the water. When you see water on the roadside, do not risk. Take care of yourselves. And I support the motion. Thank you.
Honorable Alice Wajawa.
Thank you, Mr. Speaker. I also rise to support the motion or the adjournment for a short recess. Honorable members, as you are aware that we have been working tirelessly through these sessions, and most of us have not been getting time to go back home, since many of us come from very far away. It is timely, and it is so important that we get time to rest and to go back home and get be close with our people at the grassroots, listen to them, share with them the problems they have. We'll also have time to go around our respective wards or our areas to get the problems which our people have. And also, are you aware that the schools have closed? I wish to urge our members to get in touch with the parents to take care of our children back at home, so that they can behave well during the holidays and avoid a lot of some maybe unfortunate things which might happen. I also wish to concur with our colleagues who have talked about registration of voters. We should go down and organize with our constituents so that they can register as voters, and we argue all our people, especially the youths who have not registered, who have not got their identification cards to do so and register as voters. I also wish to wish all our members a happy holiday, and pray that we will meet again after the recess. Thank you.
Kwanza nataka nishukuru kwa muda ambao umenipatia Bwana Spika. Bwana Spika, mimi kwa mtazamo wangu sikubaliani na huu mswada, na nina sababu. Sababu yangu ya kwanza ni kwamba ni juzi tu ndio tumetoka kwa likizo ambaye tulikuwa nyumbani miezi 2.5, tukarudi mwezi wa pili tarehe 9. Mwezi wa pili tarehe 9, piga mahesabu zako. Mwezi kamilifu ambayo tumefanya kazi ni mwezi wa 3 peke yake. Mwezi wa 4 pia tumefanya kazi. Ina maana ya kwamba baada ya likizo ya miezi 2.5 tunafanya kazi miezi 2, alafu tunakwenda likizo tena. Bwana Spika, tukuchaguliwa kwenda likizo mara kwa mara. Ndio sababu ninapinga mswada huu. Jambo la pili ambalo tena ninachangia visivyo katika mswada huu ni kwamba ukiangalia ndani ya miezi 2 ambayo tumekuwa hapa kwa bunge, ripoti ngapi zimekuja hapa? Tunasema tumefanya kazi gani? Angalia kwa rekodi zetu za county assembly, ripoti ngapi zimekuja hapa kama sio za pick and pack? Tuko na kamati mangapi ambayo yanashughulikia masuala ya serikali? Wameleta ripoti ngapi? Alafu hii leo hii wenzangu wanasema tumefanya kazi sana, tunataka kwenda likizo. Wapi? Hatujafanya kazi bwana. Kwangu mimi naona ya kwamba haiwezekani. La mwisho, sababu la kupinga, Bwana Spika, sote tunaelewa ya kwamba serikali ya kaunti haijakamilisha hazijatoa sabuni za kufanya miradi. Ila hali sisi ndio tunafaa tuwasukume ili masabuni zote ambazo zimetoka kwenye bajeti yetu zifanyike. Leo hii tunafunga hii milango, tunaondoka hapa, hatujui lini tunarudi. Alafu tutapata ya kwamba hakuna kazi wamefanya, kwa sababu wale pia wanataka zungusha ili miradi zisifanywe. Tukirudi hapa tarehe 20 na ngapi na 9 na 1, tupate ya kwamba mambo tutapata vile ilikuwa, tutaanzia wapi? Bwana Spika, ukiangalia kwa makini sababu zangu 3 ambazo nimetoa, mimi ninapinga. Asante sana Bwana Spika.
Honorable Emily Oginga.
Thank you, Mr. Speaker, sir.
I thought you would start in Kiswahili.
Hey. Mr. Speaker, sir, I'd like to support this motion on adjournment. Although I would want to disagree with my fellow colleague, Honorable Boyton. I believe Honorable Boyton has been fasting during this session. And I believe he's been away most of the time. That's why he feels we haven't worked. We have worked. Honorable Boyton, when you were away, we worked. And Mr. Speaker, just like usually it is said that all work and no play makes Jack a dull boy. This house needs a break. Let us go back home, back to our areas that we represent. And just like my fellow colleagues have mentioned, that let us go out and mobilize those young people to get out and register and vote in the coming elections. Otherwise, Mr. Speaker, I'd like to support this. Thank you.
Yes, Honorable Peter Bass.
Thank you, Mr. Speaker. Mr. Speaker, may I call the mover to reply?
Honorable Mumbo.
Thank you, Mr. Speaker. Mr. Speaker, as I reply, allow me first of all to thank the members for their contribution. But of importance of all the contributions, that I'll take this 1 minute to reply my brother, Honorable Boyton, for opposing this motion. I would like to remind Honorable Boyton that it is not now that you are setting the date for this adjournment. The calendar of this assembly was passed in this house the 19th February 2026. And what we are doing here is just a formality that we are accomplishing what we had passed here earlier. And to say that you don't know when you are coming back, Honorable Boyton, let me remind you again what I read earlier, that we are coming back on Friday, 3rd of April. We are coming back here on Tuesday, 21st April. So if you were thinking that you are going forever, no, we are coming back. We may go forever after August next year. So be assured you're still coming back. About what this house has done. This house has done their part. There have been good things, good debates, good motions, good reports that they have passed. There could be others that did not go well, but it is up to us now to reflect during the holiday and come back regenerated to fill the gap that we did not do during our 2 months here. Indeed, I know people have not been very active. I don't know for whatever reason, but go home, reflect. If you needed this break, it has come timely. Come back and do our duty. Legislative oversight. Mr. Speaker, this adjournment has come at a very good time. We are going home to reunite ourselves with the families and electorates for these holidays. For Christians, we are going to start our Easter holiday today, and I therefore wish all the members and their families a happy Easter. It's not going to be a walk in the park. I know there are pending works of some committees. For those committees will be called upon to perform their duties during holidays. I humbly request that should that request come to your office, kindly approve so that we complete our work good time. I support members who have called on us to go and urge our members to register for those who have not registered, those who are to change their voting stations, and even those who have not registered as Kenyans, those who have not taken identity, to take identity. We are going for election next year, Mr. Speaker, and the election is all about numbers. And only with numbers that we can boast of winning an election. We want to win elections. Mr. Speaker, ODM, our beloved party, partnering with order in the name of broad-based. And our party leader has always said that we want power. And with this power, we can only get power if we register and vote. Let us take this opportunity to educate our members the importance of taking or registering and coming out to vote so that we take power. We've had meetings. Lastly, the head of state, Honorable Dr. Samoei Ruto, visited this region to unveil projects, but more importantly, he was showing this region that is ready to work and support this region, and practically showed us what is capable of doing. All is left for us to go out and preach the gospel of two-term to our people, as we committed ourselves that we'll do exactly that, because our party has said we are not going to present a presidential candidate, but going to support Honorable Samoei. So, Mr. Speaker, I urge our members go out boldly and strongly to explain and persuade our members to support fully the broad-based that our party leader and members of ODM endorsed and mandated him to negotiate with the ODM, with the other party. Finally, I thank you all and wish you a happy Easter. Thank you. God bless you all. I reply.
Honorable members, the motion adjournment of the County Assembly sittings for the short recess until the 21st April 2026 at 2:30 p.m. have been moved, seconded, debated, reply made. I now want to refer you to Standing Order number 26(3), and I read, a day when the County Assembly is scheduled to adjourn to a day other than the next normal sitting day in accordance with the County Assembly calendar, the leader of majority party or the leader of minority party or another member of the County Assembly Business Committee shall move a motion of adjournment which shall be debated for not more than 3 hours, after which the County Assembly shall adjourn without putting the question. Honorable members, you may be upstanding. Going by that standing order, the House stands adjourned until Tuesday, the 21st of April 2026 at 2:30 p.m.